I started as a children's doctor in diabetes because diabetes is very common in children. But I got very interested when I started seeing children with unusual types of diabetes and different ones, and that was much harder to diagnose and understand. So with Nolwen's suggestion, we applied for a research grant to try and get money to set up a European register, but we didn't think we would get we didn't think we would get a European grant for just one rare disease that affected so few people. So we asked for a grant to set up a register for related conditions. So we thought it was stronger to put together a register for those three conditions than just Wolfram by itself. So the aims of this project were to try and actually bring together all of European researchers to agree to collect the same information on young people and adults with these conditions into an international register from which we could recruit young people and others when we were ready for clinical trials of new treatments for the condition. And the aim was to try and recruit 300 children and adults with these conditions to develop a genetic database that can be shared for all of the researchers around the world, and to develop a network of laboratories that would do genetic testing, so that it didn't matter if you were born in Hungary or Romania or Ireland or England, you'd all have equal access to having a genetic test done if you needed it. That was the purpose and the guidelines. So what we did was we put together 6 European partners. So in France, Véronique Paquis in University of Nice, and Ségolène Aimé in INSERM, and then colleagues in Barcelona, in Verona, in Łódź in Poland, and also Estonia. And all of these different people agreed to actually work together to try and set up a European network for this. We also wanted to try and link laboratories, and also to try and work together to develop health professional guidelines, so that if you were a doctor in any European country, there'd be a version of the guidelines as to how to look after somebody with Wolfram syndrome, and it would be the same in Spain as it was in England or somewhere else. So the project was to try and put together an electronic registry of anonymous patient records. So this would be the details of how old you were when you got eye problems, how old you were when you got hearing problems and others, to have that. Asking consent from families to include their data anonymously in this registry. Hopefully for some families to be able to self-register into this. And then letting pharmaceutical companies, if they've suddenly got a new medicine for a rare condition like this, to think where would they go to find lots of patients to take part. Oh, they come here. And this would be the resource that would encourage pharmaceutical companies to come. So that was the idea. We've developed a website called eurowab.org, on which we try to put information about the project, and according to the different flags we have information in 7 different European languages to try and make it more accessible for people. In the electronic database, it's for doctors or patients to put in information with the right consent for people as well. Really importantly, because this is such a rare condition, and Nolwen and Guy have already said we've all got to work together, we wanted to ask people if they would consent for their anonymous data to be shared with other registries around the world. So on the consent form it says on here, I agree that my child or my anonymous data can be shared with other international disease registries. And this is so that we could link up with the American registry and put all the information on everybody together from all over the world. And I'm very grateful that so many of you have consented to do all of that. We also created a genetic database of every published mistake in the Wolfram gene that we could find, that's updated on a monthly basis, which you can access freely on the website, and it's a resource for all researchers in the condition to use. And on it you can look up any mutation in the report and find out where it's been reported and what sort of features that the person had with it. We've now got about 15 laboratories signed up around Europe now who can all do genetic testing for Wolfram syndrome, so that from whichever country you're in, we can point people to the closest laboratory and say what is the test that they do and how long does it take to get a result from it as well. And that way the laboratories can sort of share their information and their costs between them. So that should help. We've been putting together guidelines which are now on draft number 14. And we're getting there now. And it's Management of Wolfram Syndrome, a clinical guideline. And what it is to tell any doctor what are the baseline tests you do to diagnose Wolfram, what are the baseline tests to do when you come to clinic, and what sort of follow-up should people have altogether. And we've got Professor Christian Hamel, who Guy's talked about already in Montpellier, who's contributed to these, and the other doctors in Germany and Spain and America as well, to try and make it a true consensus guideline. And what we're hoping to do now is to publish that, so that if you go to your doctor and he says he's never heard of Wolfram syndrome, you can say, there's a guideline now, and it's been published, and this is the way that you should be. 300 in December. So I think that's actually gone up since October. We're over about 290 now, which is absolutely fantastic. From about 9 countries around Europe, and some countries outside, like Kuwait and Canada as well. And the Wolfram families have been absolutely fantastic. With Norway's help and the French families, there's now almost 140 people with Wolfram syndrome who've consented to take part in this. And this is incredibly helpful because it's telling us a lot more about the condition altogether. And although it hasn't all come out, this just shows that for people with Wolfram syndrome, the average age of people recruited is about 19, but the youngest person is about 4 years old, and the oldest person is about 60 years old that are taking part in this study. So that's helpful to know. But what's a bit scary here is the age of diagnosis. The average age that people get diagnosed with Wolfram is about 14 years, which is still too old, it's still too late. And what we want to do is to try and help that diagnosis be made much, much younger altogether. The oldest person to be diagnosed with Wolfram syndrome was 60 years of age when they got diagnosed. So that just shows what a big spread there is and how much work we've got to do yet to raise awareness about the condition and get people understanding it much younger than we do at the moment. So that's been important. We've done a little bit on diabetes, and we can see that not everybody, but about 9 out of 10 people with this do have diabetes, but not everybody. And there are other people who never develop diabetes, and some who get it about the age of 30 or 40. And amongst all these people, there are some people with hearing problems and eye problems, but nothing else, no diabetes. We realise that's also got a mistake in the same gene, so it's related to it, but not the same. And this project is showing all sorts of different patterns that we just didn't understand altogether. Most people with Wolfram have insulin treatment if they have diabetes, but we've also found some people who are just managed on tablets who don't seem to need injections, and so there's a big variation in that as well, which is really, really interesting and important. So where this is going at the moment, really, we now need to go back and look to see how you define Wolfram syndrome, and the diagnostic criteria look like they're not right, that they're wrong. We've got to go back and look at that again with all the other international researchers and say, how are we going to define what Wolfram syndrome is and get there is. As expected, there are not many people with Wolfram syndrome are overweight, and quite a lot of people with Wolfram syndrome are relatively slim. And this might be a clue as to what's happening underneath, that there may be a problem with the way that the body makes energy in Wolfram syndrome. And one thing I've noticed in the clinics, and some of you may, is that some people get tired very easily. And I hadn't appreciated this is quite an important feature of Wolfram. And that might also relate to an energy problem with this condition. So overall at the moment, we've established a European-wide registry for people with these rare diseases, particularly Wolfram syndrome. This is helping us understand what the course of the condition is and how variable it is. But we've been able to get some nice public health aspects out of it as well, particularly about developing international guidelines as to how to look after people with Wolfram, and also a genetic testing network from this. So where do we want to go next? We're trying at the moment to link up with the American registry so that all the information can be put together. And at the moment, myself, Guy, I'm sure, and colleagues in Washington are looking to get industry involvement to say, here is this registry, here's this condition, to try and get industry companies interested in Wolfram syndrome about developing new treatments for it. And I think if they can see there's a group of families that really want to take part in research, they're much more likely to want to try and develop new treatments for it. So I think that helps as well. Can I just ask Catherine, did you want just to say anything about the project? Because you've got, if anybody's interested in the Euroweb project, we've got a bit of information here today. And Catherine, did you want us to stand up just for a minute and just mention that?
I think I've probably met quite a lot of you either last year or in the children's clinics, if you still come to the children's. Like Tim says, I've got some information sheets today for anybody who goes to the adult clinics, or I've missed at the children's clinics, or maybe I've seen you at the children's clinics and explained the project to you, but I can let you take part today. But thank you for everyone that's taken part. We find that at the clinics, people are very, very willing to take part, and that's really helpful, and it makes it a lot easier. We've got quite a lot of skin biopsies as well from the Wolfram patients, which has been really helpful. I know Tim is really grateful for all of them.
Thank you.
I don't think there's anything else.
Okay. Thank you. So that's that. So they're able to, through this, to work with our colleagues in America as well as France as well for that one. The second project I wanted to mention briefly is to say that if we're going to get a new treatment for Wolfram syndrome, what is probably going to be first is something that's going to slow down or stop the progress of the condition. Now, there might be medicines out there that Guy is developing and others, but we've got to have something that we can measure to prove that we've slowed down the condition or stopped it. And that's called trying to find a biomarker. And it might be a blood test, it might be a brain scan, it might be a physical test, but something that you can do one measure one clinic visit and another measure at the next clinic visit and show that the disease is slowed down or stopped. And at the moment there's lots of effort to find different things to look at that. And one of the areas that we're looking at with my colleagues in Birmingham is called magnetic resonance spectroscopy, or MRI scans. And some of you who've come to the children's clinic have very kindly had these scans as we've been through. And you may have wondered why I've asked you to sit in a brain scanner for 40 minutes to actually get the information. And what I wanted to try and show you was a little bit about that here today. Effectively what this is looking at bits of the brain, and it's to try and have a look at the signals of the brain chemistry within inside to see if there's any signal in the brain chemistry that can define somebody with this condition from somebody who doesn't have this condition. And could we then use that signal in the brain chemistry to follow the disease over time and see how it changes in response to future treatments? And at the moment, I think about 10 young people have come through the Children's Hospital MR scanners at the moment. And what they've been able to do is to have a look at brain slices. So this is, if you imagine that you've got a slice through the brain, and you can see the eyes and the back of the brain, there is a part of the brain in the brain stem called the pons, where there is a different signal. There is much more white signal on the right-hand side than on the left-hand side. These three areas here, and I apologise for those that can't see them on here. But the signal in the part of the midbrain in some people with Wolfram is different from some people who don't have Wolfram. And when you focus on that bit and have a look at the chemistry signal that comes out, and this is shown in lots of different peaks which responds to different chemicals in the brain. And two of these, one of these is called myo-inositol, and the other one is N-acetylamine amino acid on here. These peaks in people with Wolfram are different from the peaks without Wolfram. This particular peak is higher, showing there's more of this chemical in there, and this particular peak is lower, showing that there's less of it in the brain on there. And this pattern seems to be consistent amongst all the people we've looked at so far. What we want to do is to do this scan, if you can bear it with us, every time you come to clinic on an annual basis, and see if this bears out and holds true in that case. And what we're hoping is that if this can be a biomarker to show the progression of the condition, we can use that as a test in response to future treatments. Because somebody's going to come up with a new treatment, but unless we can find a way of monitoring it to show that it's working, it's going to be really hard to tell whether it's doing its job or not. So I can show you. I could show you those afterwards, Guy, as well, and that's sort of the pattern. I'll show you those as well afterwards, the pattern we have. Okay. The third part of this, which is funded also by Association Syndrome Wolfram from France, is trying to develop new treatments for Wolfram syndrome, and I said we needed two bits together for this. So the background to this is that we know that neurological complications in Wolfram can happen if the brain cells aren't working properly, or if some of the brain cells die, what's called apoptosis on it. And as you've heard already from Guy and others, there are lots of researchers around in France and America and in the UK trying to find medicines that will make cells live longer and not be affected by these. And it's also really important for common things like Alzheimer's disease and Parkinson's. So there's lots of research that's going on, and we hope that some of these medicines will also be useful for Alström syndrome as well. However, there's a risk that any medicine that you develop might have side effects. And so it's always really important when testing to make sure that there are no unwanted side effects from these as you're keeping cells alive for longer. So in a previous project we did, we found a protein, a well-known protein called P21 protein, which works in cells to try and stop cells dying off and keep cells alive in that area. And it's also can be quite effective at stopping cells becoming cancerous. So it's good for two reasons on there. There's good evidence that these cells can protect brain cells from both stress and cell death. And we know from a further project that there are medicines already used in the formulary, medicines that you can get in the chemist, that will increase the activity of this protein and hopefully try and reduce the amount of stress in cells. So we had done some previous work looking at some cells in the laboratory where we've removed the Wolfram protein and use it as a model of Wolfram syndrome, and then we looked at how well these cells survived. And we found that in control cells, the percentage of the cells dying was quite high, but if they had the P21 protein, those cells seemed to stay alive. And exactly the same was the case in the Wolfram cells. So in cells that we had where we'd removed the Wolfram protein, many of those cells were very stressed, but if they had this P21 protein in it, they seemed to stay alive and stay healthy for longer. So we wanted to see if we could increase the expression of this special protein in the Wolfram cell models. And if we could do that, would it stop the cells from dying or getting ill? And we hope that if we could find things that would do that, whether that might in future slow down or stop the neurological complications and eventually the progression of Wolfram. So what we did, as part of this, so we took a group of cells, these are human cells, we took out the Wolfram protein out of the cells, and they were left with this special protein called P21. We then measured how much stress was in these cells, and a lot of these stress levels go up quite a lot. And then we tried to treat the cells with medicines by putting medicines into the cell culture and seeing whether then we could see if the stress levels have gone down again afterwards. So in a lab project, what we've done is we've taken about 21 different drugs. So it's a small scale, very small scale project. But we've chosen medicines that are already licensed for use in people. So there might be medicines for blood pressure, or medicines for cholesterol levels, or medicines for treating antibiotics. Something that's already got a license to use. And if we start with those medicines and see if they work in Wolfram syndrome, it saves a lot of time in drug development, because they've already got a license for a different reason, and then we can see if they might also be useful for Wolfram syndrome as well. So we've done that with about 21 different cells, and this is an example of one drug. So we give it in no drug, very low concentration, higher concentration, and look at the effect on the cells. And we can see in some of these cells, these are absolutely fine with the drug, but if you go too high, the cells don't like it. The numbers of the cells goes down. So we know we can't expose to too much drug at that level. And then if we actually look at the amount of P21 protein, the one that's going to keep the cells healthy, going up to a certain level of the drug, this amount of protein goes up quite significantly. So this is a medicine here that increases the level of P21 protein that we want. If you go too high, the cells don't like it. And then if we look at the cells that are dying, all of the cells at these low concentrations have got a really low level of cell death. So this looks like a medicine that will increase the protein to keep the cells alive and reduce the amount of cells that are dying off. So this is what we call a candidate medicine that might be good in Wolfram syndrome. So what we did from that is we tested 21 different medicines so far that are all already in the British National Formulary. So they're medicines that are used every day for different purposes. We found 5 of these medicines that seem to have an effect on this protein and seem to do the job. And they seem to reduce cell death in our model of Wolfram syndrome. So that's great, but what do we have to do next? The next thing to do is to actually have a look in blood samples from people who've got Wolfram syndrome. So what I hope, and also their mums and dads as well. So what we may well ask you to do over the next few weeks and months is ask for a small blood sample, take out the white cells, measure the amount of stress in the white cells there, treat them with these medicines and see if that stress level goes down. And then we'll have an idea if these drugs are likely to work in people with Wolfram syndrome as well. So that's the next step on the pathway. So some of you have very kindly given some samples, and I'll talk to you over lunch about that. What we'll hope to do is to come back to you in the next few weeks and ask for blood samples, both from people with Wolfram and also from mums or dads who could act as controls. So this is where a mum or dad could actually help in this research as well. If we can show that these, at least even 2 or 3 of these medicines can work in samples from people, we can then go to the manufacturer, the drug manufacturer, and says, your medicine, it may be very good for blood pressure, but it looks like it might work for Wolfram syndrome as well. Would you help us develop a research project to take this onto market? And that's the pipeline that we need to do to get new medicines for Wolfram syndrome. And what I've described in that pattern on a small scale is what Guy is talking on a big scale in Montpellier with INSERM, and Fumi Arano and Washington University in America is also doing on a big scale, called drug screening, drug repurposing projects as well. So there are much bigger versions of this sort of project going on in other parts of the world as well. But what we really hope from it is that we'll come up with a medicine that's already out there that can be used for Wolfram syndrome as well. That's the aim. Okay. So that's that. So I'll stop at that. So that just gives you a flavour of 3 projects. And it's a big thank you to the researchers who are doing the work, and also Association Syndrome Francais, who's funded those last 2 projects, and Eurowap has funded the first one as well. Thank you. So, probably time for one question or 1 or 2, isn't it? So, does anybody want to ask a question?
In February, I think it was, and I think we've registered with the Eurowap. Would that have been automatically?
Yeah, you have, yes, absolutely.
Okay.
So I'm really grateful. So the skin biopsies, as I was talking to, so first of all, we've skin biopsies where we've got the mutations. So I've actually sent those to Guy as well, actually, so that he knows what samples that we have. 2 of the samples, in fact those 2, have gone to the University of Newcastle for making iPS cells in a similar way to Guy has said, in a related project that way. And these iPS cells are going to then be turned into pancreatic beta cells in the project, and looking for medicines that route. And Guy's ones are being turned into neurons, I think, because that's Mark Bashonsky's area. But what we're trying to do is to share the information. So whatever samples we've got, I'll let Guy know what we have, and vice versa. So thank you.
Isolated, and she had to put a letter in the Balance magazine to actually find some people to keep, to contact.
I remember it. Yes, I do.
A long time ago.
I really hope with the work that Tracy and Paul and Alan are doing that that'll get easier for families as they raise the profile of Wolfram UK. Mrs. Kelly, yeah.
With Andrea, And I just feel amazed now at how much it's galloped along, this research that's going on everywhere. And, you know, I'd like to put you on the spot, really. Are you likely, you know, in our lifetime to find a drug that will slow it down, do you think?
So until there is a clinical trial and a new treatment with Wolfram syndrome, I can't say a cure, but I can say a clinical trial. I think Guy would agree. I think we hope that there will be a clinical trial of some sort of treatment for Wolfram in the next few years. That's what we're working on.